Hi there, so my name is Dr. Vinay Gupta. I am the clinical lead of the COVID vaccination program for our primary care network, which is the Aegis PCN.
Thanks, Vinay. So my name is Dr. Imran Farooqi. I'm co-clinical lead of the vaccination program and one of the partners based at East Leicester Medical Practice, which is part of the Aegis PCN. So very happy to be answering some questions today.
So, how are we getting on with the largest vaccination program in living history?
As the kind of national figures will show, and certainly we can kind of show a similar picture locally. We are getting through the various patients and individuals that are eligible for it at a very good pace. So far it has all gone very nicely, very safely, and I would say we're generally getting on very well.
Good.
Yeah.
So with the patients that you're seeing, what's vaccine confidence like?
So it's actually been, in some ways, surprisingly good, given obviously you do see various things out there that might suggest that the vaccine's obviously been rolled out very quickly, but actually I think patients have really taken on board the fact that this has been as sort of rigorously tested as any other vaccine that we generally roll out, that the patient safety data is very good, and this is really reflected in, I think, very high levels of confidence from patients when they actually come to get vaccinated. I think the other thing is when patients are actually coming and seeing the setup we have in place and the number of healthcare professionals that are on site at any given time, I think that hopefully fills them with a lot of confidence also, and that certainly is coming through.
Yeah, absolutely. I think the vast majority of patients are confident to have the vaccine. Those who have maybe been a bit anxious at the start, I think once they've had a discussion with either one of ourselves or one of our clinicians, we've been able to confidently give them the safety data, tell them that it's been rigorously tested, probably more than most of the vaccines actually, looking at the numbers involved in the research trials, and like Vinay said, when they come to our vaccination sites, they can see how well run it is, and therefore I think that just boosts their confidence, and we've now been running it for a good couple of months and we've not had any issues so far, so absolutely fantastic.
That's brilliant. So today at the vaccination drive, how many of your colleagues are actually managing it today?
It's a very, very good question. I've probably not done an official head count, but there are a very large number of people involved. So just to give you an idea of the types of people that are involved, we obviously have a large number of administrative staff. We also have sort of the doctors, myself and Imran, amongst others. We have a variety of practice nurses, healthcare assistants, a large team of clinical pharmacists on site. I think it's also probably worth mentioning that amongst our group, which is the primary care network, which is a combination obviously of Willow's health practices and East Leicester medical practice, even outside of that there are a large number of other people that are here at any given time. We have representatives from the CCG, we have a large number of volunteers ranging from paramedics to marshals, to people who are manning, marshals also manning the car park, managing what the patient flow is like inside and outside the building. So it really is a very large number indeed, which is obviously where sometimes some of the logistical challenges arise, but that's why it's been so pleasing how well it's actually run with such a large number of people involved.
Yeah, and it's brilliant to see everyone coming together to deliver this, because I think we all see it as hopefully a way forward to hopefully get through this pandemic. So it's been absolutely really great to see lots of people coming together.
Brilliant. So it seems very much of a large team effort.
Massively, and I think probably worth mentioning the hall itself, Rajapati, obviously, for hosting us so warmly and so well. So I'd really like to thank everyone involved in that and the community involved in that particular effort as well.
Brilliant. Just quickly coming back to the vaccine, have you seen any complications or any side effects with anybody who has taken the vaccine?
So the common side effects are very similar to that of the flu jab. So aching arm, very mild headache and maybe a slight temperature for 1 to 2 days, and that is quite common.
Depends obviously on which cohort you fit in according to the guidance that we get given. And I think what I would emphasise is that when it is your turn, so to speak, you will be contacted by your relevant surgery or your relevant practice. So it's hard to probably say exactly when someone will get vaccinated without knowing, their age or what other underlying medical conditions they have. Certainly the group we're focusing on or have been asked to focus on at the moment are those adults who may have some underlying health conditions that might predispose them to be at slightly greater risk of COVID, and we are prioritising them sort of currently because we predominantly finished the older age group that were in the first few cohorts that we were asked to focus on. So we're slowly but surely working our way through them, and certainly your turn will come if it's not already come.
Absolutely. So, and to put it into perspective, there are 10 cohorts of patients set out by the government, and we're down to cohort 6. So 1 through to 6 have been done or are being done. So hopefully shouldn't be too much longer if you're keen to have your vaccine done.